I've always been interested in medicine. I've always been interested in how the human body works. When I was in high school, one of my relatives was diagnosed with cancer. And so at the time, I didn't really know what cancer was or really how it really impacted a person as well as the family. And so I really got to see that firsthand, and it really intrigued me that I knew I wanted to be a part of that field just because I wanted to help patients, but also learn more about these diseases and treatment options. Thankfully, he's doing well today, but that sort of helped me develop the interest that I had. And then when I got to medical school, I did more specialty rotations in oncology, which got me to my fellowship and currently as a practicing oncologist. The most rewarding part of being a physician is really that connection I have with my patients. It's really wonderful to get to know them at a personal level, their families, their children, sort of what are their goals. And then having that honesty and treatment plan and approach with our patients to really discuss what type of disease they have, what are the outcomes that we can expect, what are the treatment options, that kind of thing. And so to really see someone get better and have that improvement in their overall health has been extremely rewarding, and that connection that you make with patients has been something I really value and cherish. I wish my patients would ask me more about their specific disease. I think a lot of patients come in and trust their physicians and don't ask a lot of questions and just sort of go with the flow, which is great, but I think outcomes are always better when the expectations are known ahead of time. And so I always like to educate my patients with what type of cancer they have, what type of treatments we plan on having. If this treatment doesn't work, what are we going to pivot to next? So those kind of things. That way, when they go home, they really understand what is the disease they have, what can they look, forward to, or what can they expect, with their treatments, potential side effects, those kind of things. Because once they have this diagnosis, they're going to get inundated with a lot of information from family, from friends, especially with social media now. There's a lot of various forums and websites you can go to, and some are great and some are not so great. And so I think having that understanding from the very beginning helps set a nice foundation where patients can do well. I'm originally from Chicago, and so although I love Philly sports, I have a passion for my Chicago teams. And so I'm a huge fan of the Chicago Bears and the Chicago Bulls, and I follow the Cubs. And so it's been a few tough years, it's at least to say I think we were spoiled in the 90s, but I'm a huge sports fan. I love to travel. I like to play sports as well. I have 3 young kids, and we like to spend the time going biking and just enjoying the outdoors. And so I really like to spend time with my family, enjoy, sporting events, things like that. I'm Dr. Ankur Parikh. My mission at Jefferson is to improve lives.